Botox still hasn't worn off after 6 months. Is this abnormal? Is it normal for Botox to not have worn off after 6 months? I'm panicking that this is permanent. I can move my forehead. It's probably back to 80 to 90% movement as it was before. But at the sides of my eyes, it just isn't wearing off. My cheeks are still being pushed forward instead of creasing at the sides of my eyes as it did before. I'm desperate for it to wear off as I hate it. The clinic who did the Botox said they can't give a time scale for it wearing off. Advice would be greatly appreciated.
Thank you for your question. You submitted your question without a photo, and you express in the details of your questions a concern about the effect of Botox lingering beyond 6 months. You state that your forehead is returned in terms of its activity 80 to 90%, but you describe that the area around your eyes being injected, that your cheeks push forward as opposed to the way they behaved prior to getting the injections around the eyes, and that the clinic is not offering you a time scale, so you're looking for some guidance as to the effect of Botox for when it will wear off. Well, I can certainly share with you my experience. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. My specialty of oculofacial plastic surgery were amongst the first doctors to use botulinum toxin, and so I have been using Botox for my patients since 1993. So I can certainly share with you some guidance. And the use of Botox in our practice, we use it very extensively. We do everything from forehead lines to crow's feet lines, which is what you've had, as well as for everything from lip lifting and treating vertical lines around the lips, for chin dimpling. It's remarkably versatile. I mean, we do it for lifting the brows. The number of things we can do with Botox as a tool is pretty amazing. And I am surprised to hear that you perceive it lasting longer than 6 months. Generally, in our practice, I tell our patients that the average patient comes back about every 3 to 4 months, and very often it's because they want a certain level of inactivity or limited activity of their muscles to be maintained so that they don't let it wear off completely. There is a certain amount of learning about the patient that occurs when we first start doing anything, whether it's an injectable neurotoxin like Botox or an injectable filler such as hyaluronic acid filler. And essentially, I usually see our patients about 2 weeks after the procedure, and then we see them after several months. And what I do make a point of is taking photos before the procedures so that I can document what the facial movements are so that we can compare them. And there's a lot of reasons for this, one of which, of course, is to be able to show our patients the improvement. But another reason, it has to do with what the perception of people have of their appearance, regardless of whether it's the use of a neurotoxin, injectable filler, or even surgery. What we have often seen, and I don't want to imply that I assume that this is applicable to you, but I think it's an important thought to have. There is something about the observer's bias that I think is important. And a lot of times people feel that they have certain things after a procedure that they are really have conviction about not having before the procedure. And then when I show those photos where that did exist, it becomes it's an opportunity for clarity, to actually have the realization that something was a certain way. It's curious that you're describing a situation where your cheeks are pushing forward. When you treat the crow's feet lines, which I think is what is most likely was treated, what you are affecting is a particular muscle called the orbicularis oculi muscle. When that muscle is engaged, typically during squinting, that muscle is going to form these crow's feet lines. When the muscle is relaxed, those lines soften, and with recruitment of that activity, or I should say attempted recruitment, when you have Botox or any other neurotoxin on board, it doesn't contract as much. Now that's to be distinguished from the area becoming compressed and creating lines when the cheeks move upward. And that's more of what I call as an accordion effect. I don't see how the muscle reduction of activity in the crow's feet area would cause your cheeks to push forward. So I would suggest that you would discuss this in a way where if your doctor can show you the images taken, and the way I take these photos, I take the photos without expression and with expression to help my patients see the dynamics. I think you might be able to appreciate whether or not there's a direct relationship. Usually these neurotoxins wear off, and in fact it's actually a challenge to try to stay on top of the rate of the reduction of activity, because it's always about, at least in my practice, I try to keep my patients looking natural, where they can have reduced activity but still preserve some of their natural movement so they don't look like they have been, quote, Botoxed. And so I think that in your situation, you can be confident that even if it is lingering a little bit longer than it would be expected, that it will wear off. There has yet to be any awareness in my, as far as I'm aware in my practice of doing this for so long, where a person would have a long-term effect due to the natural pharmacology and physiology. The Botox wears off. I think it's important that you maintain this dialogue with your doctor and see and hopefully you had some photos taken beforehand. But if you were to get a second opinion, I think another physician can simply evaluate the muscles that were treated and give you some sense up to the degree of those muscles actually working at this point, regardless. And maybe they can give you some guidance as to what is any residual effect of Botox, or if the Botox has worn off. So I hope that was helpful. I wish you the best of luck. Thank you for your question.